Hi everyone. I wasn't able to make it to the clinical conference, so my presentation is on Lyme disease. My case study starts with a 16-year-old male patient presented to the office with complaints of bilateral ankle pain, left knee pain, and right hip pain, with occasional left hip pain intermittently for the last 2 weeks prior to when I saw him. He is an Amish teenager and he works on a farm. Doesn't recall any bites or ticks or insects or anything like that on him and denies trauma. Denies fever, chills, shortness of breath, chest pain. No redness, warmth, swelling, or decreased movement to his joints. He has not self-treated the joints at all. The Amish like a lot of self-treatment. Has not taken any ibuprofen or Tylenol either. Review of symptoms: denies fevers or chills, complaints of pain to multiple joints over the last 2 weeks. No dizziness, no complaints to the head, eyes, ears, nose, or throat. Denies chest pain, shortness of breath, no nausea, vomiting, or diarrhea. Musculoskeletal: he complains of bilateral ankle pain, left knee pain, and denies injury. No medical surgical history. No smoking, denies alcohol, denies illegal drug use. He's an Amish male, lives with his family on the farm. Unknown family history, and takes no medications and has no allergies. Blood pressure that day was 120/74, heart rate 80, respiratory rate of 20, no fever. Pain 2 out of 10, although they are extremely stoic, but he did not appear to show any signs of pain and didn't really understand the pain scale very well. He is well nourished, well developed, very tall, 16-year-old male, sitting on the exam table. His father was in the room, no acute distress, no vision changes, no headaches, cranial nerves intact, pupils equal and reactive. Like I said before, his exam to his head, ears, eyes, nose, and throat was completely normal. He had no complaints. Heart rate regular, rhythm regular, no murmurs, no rubs, no gallops. Respiratory rate regular, non-labored, lungs clear and equal bilaterally, no shortness of breath or dyspnea on exertion. He had good pulses to all of his extremities with good strength and equal sensation, equal strength in all extremities. No edema noted, no swelling noted over the joints. Complaints of bilateral ankle pain, no swelling, no ecchymosis. No pain or tenderness with palpation. I palpated his knees bilaterally for comparison purposes, and although the complaints were only on his left knee, there was no pain with the palpation when I did this at all. There was no swelling, no decreased range of motion. There was no laxity at all in these joints, and no ligament, no evidence of any ligament or meniscal injury. Bilateral hips were again palpated for comparison purposes, although that day he was not really complaining. He was complaining off and on of the hip pain. No decreased range of motion, no pain or tenderness. I thought maybe there was a little bit of maybe a hip bursitis, but there was absolutely nothing. No reproduction of the pain with range of motion or palpation of the ankles. No knee pain, no hip pain, no signs of trauma to the joints, no abnormal gait. And again, like I said, he was really, I'm not sure that he understood, even though he said his pain was a 2, I'm not sure that he was really able to understand what I meant. His skin was completely intact. There was no lesions, no rashes, no ecchymosis, no redness. Differential diagnosis: joint pain involving multiple joints. This can result from overuse or from injury. That was very basic. My second one was Lyme disease. It can be separated into 3 stages: early, early disseminated, and late. Only a small amount of patients recall an actual tick bite, but as many as 80% of the patients will report arthralgia or migratory arthritis. And then rheumatoid arthritis screening. We did do some rheumatoid factors for him. Rheumatoid arthritis is autoimmune disorder that targets the synovial linings of the arthrodial joint. The plan was to do lab work, include a CBC chemistry of Lyme titers, sed-rate, CRP, and RA factor. Possibly joints, x-ray of the joints of the lower x-rays, and if the pain persists, and if the blood work is negative. This is what we suggested to them. Honest patients who self-pay, and they tend to decide what they are going to do and how they're going to do it. We also recommended 600 milligrams of Motrin 3 times a day to decrease the pain and inflammation, alternate ice and heat, whatever made them feel better, to the affected areas as needed for comfort, rest and elevate the affected areas, especially after the day's work is complete, and return to the office if he needed to, especially if he developed other symptoms such as fever, swelling, or increased pain or instability or inability to bear weight. Signs and symptoms, the most common is erythema migrans, or EM. It's an expanding rash and is usually the first symptom that people notice. This is that classic bullseye rash. It most often is evident anywhere from 3 to 30 days after transmission, so right in that early stage. It's usually present in 80 to 90% of all cases. It's not painful or itchy. It lasts anywhere from 3 to 5 weeks, and it can look very different from person to person and depending on the color of their skin. Diagnosis. In the early stages, it's usually diagnosed clinically. Lab work for this in the early stages is usually non-diagnostic. It's usually inconclusive. So if they have a rash and they know that they have a tick bite, they are usually just treated for the Lyme disease. General lab findings can include an increased sed-rate, microscopic proteinuria, or microscopic hematuria. ELISA is used to detect the antibodies for the bacteria. And a Western blot is done if the ELISA is positive, and this is done to confirm a diagnosis, and this is considered a two-part or a two-step approach to the diagnosis. The Western blot detects more antibodies and several proteins to the bacteria. A PCR, or polymerase chain reaction, is drawn often from the infected joint and detects the bacterial DNA, and it helps to detect the Lyme arthritis. It can be used also in cerebral spinal fluid for those who have CNS symptoms, but a LP has to be done. And CSF testing for Lyme meningitis may show increased protein, but usually normal glucose and lymphocytic pleocytosis. Unfortunately, a single positive serological test cannot determine if there is an active or past infection. It can't differentiate between the two. And serological testing can't be used to measure the response to treatment. Treatment is done by antibiotics. If given early, they usually have a great response and usually recover fully. Adults, the medications are the same, but the choices of how you give the antibiotics are different. In adults, doxycycline is the first choice, cefuroxime is the second, and amoxicillin is the third. Children, amoxicillin is the first, doxy is the second, and cefuroxime is the third. Adults get 100 milligrams BID for 14 to 21 days, cefuroxime 500 milligrams BID, and amoxicillin 500 milligrams TID, all for 14 to 21 days. And then children is always weight-based with maximum doses. Antibiotics can also be given IV. One article that I read talked about ceftriaxone. Ceftriaxone can only be given IV, and it's usually IV treatment is usually if the oral treatment has failed or if they have recurrent symptoms. Ceftriaxone is given 2 grams once daily for adults and 50 milligrams per kilogram once daily for children with a max dose of 2 grams. It is highly active against the bacteria, and it reaches high levels in CSF and the synovial fluid of the joint. And it's really effective against the disseminated Lyme disease. And again, this is usually used like if it's recurrent symptoms or if the oral antibiotics have failed, or if it was completely undiagnosed and we're kind of now in this, oh my word, what do we do now? So how do you prevent this? Deer ticks are very small and it's very hard to detect. So the immature ticks, the ones that haven't been able to feed yet, they're like the size of a poppy seed. Adult or the engorged ones can be as big as an apple seed. So wearing light colored clothing, this helps be able to spot the ticks. So they're dark. So if you have a dark spot on a white shirt or a light shirt, you're able to spot it a little bit better. Wearing pants or long sleeves can help to protect your skin, but being cautious of this because they will try to crawl to find the skin so that they can feed. Removing clothing and placing them in the dryer for 20 to 30 minutes will help to kill the ticks that may be on the clothes before you carry them into your house. Showering upon coming in from outdoors will help to remove the loose ticks that may be on your skin that have not latched on yet. And then you want to check everywhere. They like the areas that are creased and protected, like the armpits, the groin, the neck, the ears. And if there is a tick on the skin, it's recommended that you move it by grasping a tweezers behind the head, like immediately behind the head, and gently pulling out. The articles that I read said that you're not supposed to try to suffocate it with like alcohol or Vaseline or any of those fun things that we used to try to do. And then what it said to do is to kill it. We always flushed ours down the toilet. I can name some other things that we used to do, but just, get rid of it so that it doesn't try to reattach itself. Another thing that you can do is use a DEET repellent. If you don't want to put it on your skin, you can put it on your clothing, and that will help as well. That's it for my presentation. I hope you have a good night.